Now the first thing, when I ask you to do general examination, I do not expect you to do vital signs. We have passed vital signs. So after taking temperature, blood pressure, breathing rate and everything, we go for general examination. Now, it begins with general inspection. What you're going to do, either the patient should be in the sitting position, the Fowler's position like this, or they should be in a semi-Fowler's position, you know, the 30-degree angle, on the bed, lying. Of course, we're not doing in a bed. This is probably how a doctor's office setup would go. So, first off, how we sit. We make sure the patient sits, ma'am, could you? Exactly. My legs should be toward this side and her legs should be that side. And that way I have an easy access to her face, to her ears and everything. When I need to get up, I'll get up. Alright, first thing, inspection. I go a full scan looking for defects, any deficiencies, any bruises, trauma, scars, marks, bumps, absolutely anything. Any discoloration as well. Discoloration is a big thing, by the way, you shouldn't forget it. Second goes with palpation, and I pick one region. Either I pick the head or either I pick the hand, whichever is convenient for you. You go with it first and then you switch to the second. Since you guys elected to do the head first, I'll go with the head first. Now, with the head, general inspection of the face and the head together. I go tell her to please look towards me. Now she is looking towards me. Now may I touch you, ma'am? Mm-hmm. Alright. I grab her face right at that angle, alright? Then I laterally move it to this side and then to that side and make sure that there are no marks, nothing asymmetrical that I could find on either side. And I readjust it to the center, right? You could relax, don't worry. Alright.
You can buy.
Now, the first thing, when I've checked for the face, I go with the eyes. On the eyes, I stretch the upper eyelid like this and flash the torch like that. I'm looking for jaundice when I'm doing that. So I grab her eyelid all the way from bottom to top and I flash the torch like that. You know what? You can come here if you want to. I grab the eyelid, push it above, and then make sure she's looking down. Ma'am, could you look down? Downwards to the floor. I now have the full view of the eyeball and I place my light underneath the eyelid and I look for any yellowness. If I see no yellowness, that's no jaundice. If I do see yellowness, that is jaundice. Then I tell her to look on the top and I lower her lower eyelid. I flash it on the lower eyelid and I look for redness. If there's ample amount of redness, that's good. If it's pale or very pink, that's anemic. Then I simply look for both the eyes. Remember the eye reflex? I shine the light on one of the eyes. I keep a hand like that. I shine it on this eye. I check if the pupil constricted or not. If it constricted on the left side, that's good. I do the same with the right. If it did on both, very good. Second one, I go for the indirect light reflex. I shine it on the left, but I look on the right. Looking for any constriction of the pupil on the right side rather than the one I'm shining. And I do the same with this one. I shine it on this, but I look on the other eye, looking for the pupil's constriction. And that should be similar too. Both basically measure different kind of nerve. So that's why we are doing it. The first one, the direct one, is for optic nerve. The second one is for another nerve you don't really need to know. Second comes with the nose. Now, I do have a nasal speculum, but I'm not going to use it right now. But what we basically do is, I grab her face, I tell her to look above and tilt her head above so I could view her nostrils easily. I grab the nose from the tip and I shine the light using a speculum. I shine light underneath the nose so that I could see behind it. I'm basically looking for specifically any redness, any obstructions, or any kind of nasal discharge, secretions or mucus to be known to me. If there's congestion, I call it congestion. If there's inflammation, I let it be known. Finally, I tell her to open her mouth so that I could view the oral cavity. Please, can you move? Say ah. Now I would view it using a torch. I'm basically looking for general hygiene, general dryness on the tongue, and specifically the gums. Can you open your mouth? Thank you. I'm viewing the gums for any kind of inflammation or oral ulcers or something. I'm also viewing her tongue just to assess how much dry is her mouth. If it's very white, that means she needs to drink water. There is a lot of dehydration going in her body. If it's pale or, normal, you're good. Afterwards, I tell her to raise her chin and I look for any deformity on the neck. I see none. I don't see thyroids popping out or something. I'm good. You're good. I can do the lymph nodes right now, but if you remember it right, the neck one, lymph nodes actually require me to go all the way back and then do it. I would rather do everything while I'm still sitting so that it's least distracting for the patient. So I would skip the neck one and I would save it for later. I directly go with the hand now. With the hands first. I raise her hand, tell her to go like this in front of me so that I could compare both the hands. I'm looking for hair distribution, paleness, regular things. Paleness, hair distribution, and any patches, red or white, otherwise. I tell her to go like this then. Same thing. I'm comparing the same thing hand to hand. Maybe my pink is too pink for her. So I need to make sure both her hands look the same. Okay, after it's done, my first step would be view the nails. Now she's wearing artificial nails. But otherwise, in a normal person who is not wearing one, like me, you'd be checking for signs of cyanosis, that is bluing, signs of pitting or white thing coming up, which is the sign of lack of calcium, sign of cholinakia, spooning of the nails. If you look at a nail like this, can you raise your nails like that? She's wearing artificial nails, so it doesn't apply to her. But look at the bump that is making it. It's giving it a curve like this, like a camel hump. That hump means clubbing. Alright? And if it was the opposite, going downwards rather than upwards, that's cholinakia. Alright? The clubbing happens if you are a patient of COPD. Spooning or cholinakia happens if you are anemic due to iron deficiency. Alright? So clubbing because of COPD. Cholinakia because of anemia, iron-based anemia. Okay, once nails are done, you go for palmicide. You check for the muscles if they seem reasonable. Reasonable meaning comparably the same. They should not look as if it's just bones. That's just not normal. And you also go for one test for anemia. You let her make a fist like this. Make a fist, tighten it as if you were going to punch me. Think of something horrible and now release it. I'm looking for specifically how long did it take for the whiteness to go away. If I press it like this and I go like this, and I go like this, it must go white for momentary reason. At max, it should not be more than 3 seconds. If it is, you are lacking blood overall. It may not be a very good idea to do a transfusion from you. To you is different. Now, last one on the hand is the radial pulse. That one we all know. In this case, we are not exactly taking the pulse. We are not interested because we already did that. We are just making sure that, when we went through it through the vital signs, it was the same. So we don't count all the way to 30 seconds or 60 seconds. We do a quick checkup for 15 seconds. And we just go like, okay, I got 17 when I was doing the actual one. In this one, I got 60. That's good enough. If I get something really weird like 40 or something, or 100, I'll double check. Alright? Now, radial pulse. After I'm done this, I'd go on the forearm and I'll do the brachial pulse. And if you have not done the blood pressure, I'll do the blood pressure right now. Alright? Right now. So I'm going from the hand to the arm where I did the blood pressure. Now, the only thing remaining, because I did the head, the neck, the hands, the forearm even, the only thing remaining are the lymph nodes as far as this region is concerned. The most convenient would be do the axillary first, because I'm sitting and axillary is done in the sitting position. So I tell her, since I'm facing this side of her body, I'll tell her to place her arm on my lateral side of the body, which faces her. I could have done this way too, but that's weird. This side. And I use this arm which is next to her. Notice, alright? This arm should stay free for any kind of mobility. Torch could be kept away now, because I really don't need a torch. And basically I'm going to palpate. Of course I need to be gloved. I'll palpate the apical, the anterior, the posterior, and the medial part of the lymph node. Once I've done that, I'll release her. Since I also want to check hers, I'll change my position. I'd go this way, I'll try to go that way. Now her arm should be this way and I'll use this arm. Forget this arm. And I go this arm and I check the axillary lymph nodes all the way, same fold. Now I could get up all I want, because the cervical lymph node required me to. I come back side and I start with the, you're okay, I won't touch you. I start off with the submental, submandibular, preauricular, postauricular, bent her, the head towards this side, and then palpate for that muscle, the sternocleidomastoid muscle. Just call it SCM. That's fine. And I check for upper, middle, and lower 1/3 for any lymph node, like this. Both sides of the muscle, this side and this side, like this. And I do the same with the other side, keeping one hand on her head so that she doesn't faint, she doesn't move at all, and I do it with the other. And once I've done the supra or subclavicular, whichever you want to call it, right here. Everything about her body is done. The last thing that remains is her feet and her lungs. Now, lungs we most probably have already done thanks to vital signs that we just took. But if you haven't, before going to the feet, you would have done the lungs now. Alright? So it only happens if the doctor tells you to do vital signs only, or tells you to do vital signs plus general examination. It is very rare that anybody will tell you to skip vital signs and do just general examination only. Anyway, I'm done with the neck and everything. I go for the chest, looking for any breathing sounds. So I go with the stethoscope, I count her breathing rate while I'm doing it, okay? And I check for lung for any additional sounds all the way over. I do that, it's done, taken care of. I've done the chest. Of course, I will not strip them because that's extensive general examination. Last but not the least, I'll tell them to please remove their shoes and socks so that I could see their feet. And I would want to see hair distribution, musculature, and if there's cyanosis and koilonychia. The same thing that we do with the hand. Everything the same. Koilonychia, clubbing, hair distribution, color. Only one thing is extra, edema, because feet are most probably the most affected limbs as far as edema is concerned. So I just check her legs for the edema and that's it. With edema, you should remember one thing. Can you raise your leg all the way up to the toe? Thank you. When I do this, of course her boots and everything will be taken off. I'm going to turn her feet towards this side so I reveal her ankle. And I'm going to press with the thumb. Hard enough like this. Hard enough to press.